Well, good afternoon. I'm John Engen, Mayor of the City of Missoula, and with me today is Commissioner Josh Slotnick, and it's our May 13th briefing. We've been a little bit remiss in getting out to you, but things are calming down a little bit, and Josh and I are getting called back to some of our normal or semi-normal duties as executives in our respective governments. But today we have the privilege of being joined by Dr. Rob Stenger. Rob is the Physician Health Board member for Missoula County, and he also runs the fabulous residency program for Western Montana that's training new young docs who want to do family practice in places just like Missoula and around the state, and we're grateful for that program, which has enjoyed enormous success here. So Rob, thanks for that work. Thanks for your work on the health board. And thanks for joining us today to talk about what else, COVID-19. In particular, we wanted to talk today a little bit about testing, what we know, my relentless agitation for more of it, and what you think we might expect. And Josh has your first question.
All right. So, Dr. Stegner, well, before I dive in, I just want to say thanks too, as the mayor did. Having that residency program here adds so much value to PHC and to our community. And I really appreciate that you've chosen to do this, given that you could choose to do all kinds of things with your time and skills. So, where can people get tested?
Great. Yeah, let's dive in. And thank you. I appreciate that. It's really great to be able to be serving the community that I grew up in this way. So the work of taking care of patients and training others to do it is near and dear to my heart. So in terms of testing, right now there are lots of places in Missoula, both the city and county, where people can get tested for coronavirus if they have symptoms. So the health department is operating a testing site at the Missoula County Fairgrounds, and that's right now by scheduled appointment, and people can call the health department line at 258-INFO and get scheduled for that. And actually the health department is just starting tomorrow to have a mobile testing unit that is going to be traveling around to other kind of more remote parts of the county. So I think that they're going to be in Clinton for their first run of that tomorrow, and then going out other places around the county. So for folks that are, maybe in more rural parts of the county, they can call that 258-INFO number and get connected for one of those kind of rural testing opportunities starting in Clinton tomorrow. In addition, there are lots of other clinics around town that are testing. So there's still testing happening at, the Providence Grant Creek Clinic, Community First Care out on North Reserve, the several different cost care locations, Partnership Health Center, probably some other clinics in town as well. So there are lots of places where people can go in Missoula and get tested for coronavirus.
And who should get tested?
So that's a great question, and this is an answer that has changed over the past couple of weeks. So I think right at the beginning, people might remember we were super short on testing supplies and saying we really only want to test sort of sick and vulnerable people, and that has now changed. And the message now is that we really want to broadly test anybody with suspicious symptoms, even people with mild symptoms. So the things that people have heard about before, if you have a fever, cough, or shortness of breath that are new in the last couple of weeks, any of those symptoms, we would want those people to find one of those testing locations and get tested. But there's also a new list of symptoms that the CDC has released, and that includes things like muscle pain, loss of taste or smell, if you have new vomiting or diarrhea, if you have a sore throat. So really any of those lists of symptoms, even if they're mild, anybody experiencing any of those should think about going to get tested. And I think I can't stress enough that even people with mild symptoms, because that's going to be our best way of knowing if we're starting to see coronavirus back in Missoula again. We're probably going to find it in those people with mild symptoms first before we see really sick people that are, for example, showing up in the emergency room at the hospital.
Great. So as usual, Dr. Stegner, here in the city of Missoula and the county of Missoula, we are kind of in an alternative universe in that our numbers are great. You've watched some of the news on your computer, and it's the rest of the world is in a terrible spot. But meanwhile, we've had no new cases in multiple weeks. What's the risk of exposure in Missoula County right now?
So right now we believe it's low, and you are right that the last positive case we had in Missoula County was way back on April 13th, and the last and that was, I guess, the last new case, and I think the last active case that we had was for several weeks ago now. So right now the risk of exposure out in the community is pretty low. However, I think the important message for people is that could change really quickly. I mean, there's still coronavirus other places in the state, other places in the country. And so and even just a few people coming into Missoula County and coming in contact with people that are still susceptible, we could see this kind of fire start back up again in our county. So I think people can be reassured by those numbers, but I think people also need to continue to be vigilant in terms of, as they're out in public, observing all those things we've been telling people to do, observing that 6-foot distance when you're out and about, still wearing a mask when you're out in public in case you may have early symptoms and not know it, so you're not spreading things, washing your hands. I mean, I think that the fact that we've done all that so well as a community is why we have no cases and haven't for several weeks. And the way to keep us in that boat is for people to continue to practice those things when they're out in public.
Thank you. And want to continue to emphasize that, keep doing what you're doing, because this thing can turn on a dime, and that's just the nature of it. So Rob, we're hearing a lot about antibody tests. We're hearing about variations on the testing media and testing techniques that are available. Can you talk a little bit about what's out there and what we're using today?
Absolutely. So all the places that I just mentioned, the test that is most commonly available across all the places right now that are testing is some sort of a swab that's stuck in your nose. Sometimes it's stuck way back in your nose. Sometimes it's stuck a little bit further, just towards the middle or the front of your nose, depending on the protocol that each of the different places are testing. But that test is looking for people that are actively infected with the virus. So that is good for people that are having new symptoms or have been recently infected. So that's why for symptomatic people, we're talking about if you've been symptomatic for a week or two or less, we want you to go get that test. The antibody tests are looking for, do we think somebody has maybe had coronavirus in the past and they now have antibodies to it? And right now, there's a lot of information about those tests, and the message I'd spread to people is that we don't know yet how useful those tests are in the short term. In the long term, they're probably going to be an important part of our strategy to know who's had the virus, but in the short term, there's some things that we don't know about those tests that don't make them very useful. One thing is that there haven't been good studies to show that having antibodies means that you have persistent immunity. So for some diseases, we know that to be the case, that once you've had measles, for example, and you have antibodies, or once you had chickenpox, or if you've been vaccinated for those things, that immunity lasts. For coronavirus, we don't know that yet. And there are some strains of coronavirus that cause the common cold that people can get over and over again. So that's one problem with the antibody test, is we don't know yet what exactly it means if somebody has antibodies. The second problem with the tests is that some of the ones that are out there have significant false positive rates, meaning that you may have antibodies for some coronavirus, but it might not be COVID-19. And you may still be susceptible to COVID-19. So because of that, I think we're going to see more antibody testing. We're going to be learning more about how to use them clinically. But right now, both of our major hospitals in Missoula, as well as the CDC, aren't recommending kind of widespread use of antibody testing, and we are still learning about how to best do that. So my message right now is talk with your healthcare provider. There's maybe some limited clinical scenarios where an antibody test is helpful. But otherwise, the main message is we want to test people that we are suspicious that they might have coronavirus infection now with the nasal swab tests that are looking for the virus.
Great, thank you.
Thanks. So right now, Dr. Stegner, you're saying that basically we have enough tests to test everyone who is experiencing mild symptoms, and we've been doing a pretty good job of that. When do you see a time when we'll have enough tests that we can really just start testing anybody who wants to have a test so we can really nip it in the bud before it spread?
Yeah, absolutely. And that's a sort of great question about like what is our strategy going forward for surveillance in the community. And I think that the plans are underway for us to really ramp up. And the governor, has kind of outlined a broad strategy that's being rolled out to all of the counties in the state about how we ramp up that testing. And so I think that over the next, starting as soon as next week, we're going to see more of that ramping up, and it's going to be sort of in phases so that we can most effectively detect coronavirus if it happens to come back to Missoula County, which it will eventually. I mean, that's important for people to know. We are going to see more cases of coronavirus in Missoula County at some point in the future. We know most people here haven't been exposed to it, and so we want to have that surveillance system in place. So I think what that looks like and what people are going to start seeing over the next several weeks. The first tier of that is just expanded testing for people that have symptoms. So I think the big message now is that testing for people with mild symptoms is available. And if you have new mild symptoms, we want you to go get tested. The next phase of that is starting to test sort of asymptomatic people and getting enough of a sample in our community that we can, sort of have that early detection of, hey, there's some people that might not be yet experiencing symptoms, but we're doing enough testing that we kind of know that. And to do that, we don't need to test everybody. There are lots of estimates out there about how many people to test. The governor has set this target of saying in Montana, we'd like to test about 60,000 people a month, which if you think about that in Missoula County terms is, 6,000 or 8,000 people in Missoula County a month, and somewhere around, 1,000 to 1,500, maybe even up to 2,000 people a week, depending on how we do that testing in Missoula County. So I think that over the next month or so, we will be working up to that. And in addition to testing people with symptoms, the other sort of tiers that the governor has laid out are thinking about testing members of the population who are asymptomatic but vulnerable, meaning we know that they're going to get a lot sicker if they get coronavirus. So that's starting to test folks in some of our long-term care and senior facilities in town where people are living close together and staff in those facilities. Starting to focus testing on members of our tribal communities because we know that they have, greater vulnerability, maybe sometimes lack of access to healthcare. Starting to test people in other group living facilities, whether that's group homes or jails or other places where people are close together and it can spread rapidly. And then the last tier of that is sort of asymptomatic members of the general public. I think that we are likely to think first about focused screening in members of the general public that are in contact with lots of people. So starting to sample healthcare workers, people working in retail, clerks in stores, people working in those businesses that are reopening, and also making testing available to anybody that wants a test as well. But I know I'm not answering the question fully, but I think that's how we will be rolling it out. And I think that this is one of the things that I'm happy about is there's been a really good collaborative effort between the state health department, the county health department, local hospitals and clinics about how we accomplish this, because I think everybody's going to have a little piece of the testing that we want to do in our community to have that early warning system where we know quickly if coronavirus is back.
So Doc, we need information, right? The fact of the matter is that we're reopening. We're doing that in a way that we think is slow, symptomatic, and appropriately cautious. But why is testing important as we move forward with opening things up again?
So I think that it really is that early warning system. You know, if we know early on that there are a few cases in the community, the strategy of identifying those cases, identifying their contacts, being able to isolate those people is manageable. And that's what we've seen in other countries is, you know, the shutdown and the keeping everybody at home was effective to stop the, you know, a lot of spread, and then that sort of methodical public health approach of we find cases, we find their contacts, we isolate people works well when you have kind of a low level of disease in the community. When you have a really large level of disease in the community, that kind of public health approach doesn't work very well, and you're left with just sort of needing to shut things down to prevent transmission from happening. So I think that as we reopen, having that early warning system so that we can detect a few cases in the county or the city when they happen and being able to isolate those folks is what's going to allow us to stay open and be able to, and I think that, again, along with everybody doing their part, is what's going to allow us to stay open. So we need to have testing and we need to have the early warning system, but members of the public need to continue to be vigilant and do their part by wearing masks and hand washing and distancing. The businesses that are reopening are doing their part in terms of thinking about how to reduce contact with people in their businesses and keep their employees protected and make sure that their employees aren't symptomatic and sick when they're coming to work. You know, the government has their part to do in terms of making sure that that testing and surveillance system is working well. So I think as we reopen, everybody has their part to play in terms of trying to reopen in a way where we aren't seeing huge spikes of coronavirus in Missoula County.
That's great. Well, thank you very much. We appreciate your time. Anything we missed today?
I don't think so. I think that your guys' questions were really good, and I hope this is helpful to people, especially as we're looking towards, you know, warmer springtime weather in Montana. And I think all of us probably have a little bit of cabin fever and want to get out and about a little bit, but do it in a way that keeps our whole community safe.
That's great. Commissioner.
Thank you so much, Dr. Stagner. Well, I did have one question just jump into my head. If we go off script for just a small, just tiny bit, our numbers have been low. We've obviously been reaping the rewards of doing things right. If one case pops up or two cases over the next couple of weeks, I want to see that not as a failure, but as we're still doing well. What do I have that right?
I think that's exactly right. I mean, and we are definitely going to see more coronavirus cases in Missoula County, but we want them coming in ones and twos, and we want to be able to keep on top of them and manage them. We don't want them coming in the dozens or the hundreds. So if we see cases coming in small numbers as we reopen and it's manageable, that absolutely is what success looks like. It is not realistic to say that we're not going to see any coronavirus in Missoula County. We will, but we want to see small numbers of cases that are, you know, manageable by our public health department, by our hospitals, by our clinics. And as I said, everybody has a role to play in that kind of success scenario.
Thank you.
Okay. Well, thank you, Dr. Stenger. Thank you, Commissioner. Thanks everybody for heeding good advice from people who know what they're talking about. Yeah. And we will keep plugging.
All right.
All right. Appreciate it.
Thank you.